this meeting and being on time. I'd like us to have just very small introduction of self and purpose. Let's begin from the back.
Good afternoon, everyone. My name is Dr. Kappa. I hope you can follow.
Good afternoon, everyone. My name is Hawa Usman. My name is Mrs. Hannah Amelia. I'm the lecturer. My name is Chalani.
Hello.
My name is Chalani from IOM, I'm the protection officer.
Good afternoon, everyone. My name is Narita Ayu. I'm a mental health and psychosocial officer.
Good afternoon, everybody. My name is Ruth Mopa, and I manage protection programs.
Good afternoon. My name is Dr. Wale Kulwani. I'm the National Operation Statistician.
Thank you so much.
Good afternoon, everyone. My name is Dr. Amanda Mureba. I'm a migration health officer.
Thank you. So how do we begin? My name is Dr. Minu, and I think we can just use the agenda just to go straight, right? We're supposed to have a very quick appraisal based on the agenda, so over to you.
Thank you very much, sir, for the opportunity and to be at your facility. And we've been working together for some time, both health and us, and especially during the arrivals. Hotel has always been the one, always on ground each time. I know Dr. Okafo, I know Chief, I know at the airport. And working together jointly to ensure that medical surveillance of those people that the returnees to Nigeria. So we want to appreciate the Director of Health and all other the team for the efforts. On behalf of our managers, I want to say thank you very much for your help and your collaboration with us also. Thank you very much.
Thank you, Dr. Wale. In fact, he has been so very helpful. I think he brought a dimension in terms of communication to IOM, which was very typical of 2023. I think he has done very well in terms of communicating the impact and also the progress we are making, the issues that we have, and providing even solution. And sometimes he will even visit to look at things and see how. I've met him and Ayu before. I met you in Ghana, and I met you during the inauguration of your new lab. Yes. So welcome to this big team. In terms of universal health coverage, you remember very well the current coordinating minister gave a launch of the universal health coverage, along with his concept for overall management of health, which lies strongly on the blueprint for health. What we're having before his time was like looking at all of the strategic health development plan, yes, that provide a framework of 5 years, which the new edition is still not ready. But instead of following that route, he said he was coming out with a blueprint, which is the best practice globally. And in the blueprint, something really happened, very importantly. I had a call from World Bank because the decks I was holding before coming here was in the Department of Health Planning and Research and Statistics. And during that period, we were able to sign a country compact, which was a document to implement the health development plan at June. Unfortunately, since I left to the time I had a call from World Bank, it was not implemented, even when all of the partners, the development partners, signed. And so the call I said, oh, it could be a very important document for the blueprint. And if you look at the wordings of the blueprint, it's like a mirror image of the country compact. I remember very vividly during the signing of the country compact, the international development partners represented by co-chair, which is UNICEF say in a segment that that document was the second US have signed outside the US. And so that underscored the relevance of the such document. And what that document tends to bring on the table is, putting all resources together in a basket, like you have in London of the UN, to implement and have a common front to help progress. So for us, our contribution, our activities here contribute very, very strongly to attaining the universal health coverage. And I know whatever we've done in the past and what we are doing now, provided they are properly documented, will provide evidence of the contribution we are making through this collaboration to the universal health coverage. I would say at the primary health care and health insurance level, the kind of work we do here could be a simulation of both the primary health care by way of our outreach and then secondary and possibly tertiary health care. The three of them occur in different strata. Our lab provides tertiary level of care, and I'm sure you've got to our lab, maybe I can help this to also go. Then the activities we carry out here after the lab result, particularly at the level of the food handlers or those that handle food, agencies that handle food, we move from primary, which is the basic test we do, to secondary, and then possibly to tertiary, depending on the need for, increasing and improving on the test of the abnormalities we have observed in the process of work at the lab. So in that way, centralizing our reports across the reporting line through the local government to the state and then development partners, and then central to the NCDC and the Federal Ministry of Health, to provide evidence of the kind of work we do, picking all of the data from all the diseases we do and we work on. But in terms of health insurance, the interface we have had with the National Health Insurance Authority, it was called SKIM before, was when I resumed work here and I paid a visit to them at Yaba, at the secretariat, at the federal secretariat in Yaba, and they expressed willingness for partnership. They expressed willingness for partnership, but their basic package is that of pooled risk pooling, where you identify a pool of risk, like migrant now, and then a separate package will be developed to meet whatever the needs might be once we do our internal need analysis and then present them for funding. Beyond that, they were also willing to meet up with infrastructural requests. In fact, they requested a letter from Port of Services from that visit, but because we scale our priority in terms of implementation, we are yet to get there, because what we developed after that visit was a 3-year costed action plan. And they come, I think, number 10 or number 2. So this visit and this inclusion of health insurance makes very, very good sense for us to carry on from where we stopped that time. And it will require a joint visit of this partnership to their office to reawaken, to re-emphasize what was pledged and on the need to really develop a package for. But beyond the National Health Insurance Authority, there is what we call, is it Lashima also, the Lagos State. I was also in touch with the CEO, and she has told me her door is open anytime I want to visit, and all it will require just like a 24-hour notice before that. And so I think we can develop a visit or a courtesy call that will visit the National Health Insurance Authority as well as the state. It will be the same thing, but again, it's something we can all look at and see how we move forward with that. But in the context of HIV/AIDS and STI, We also wrote last year and visited the HIV/AIDS Trust Fund, and their CEO has actually responded by also paying a courtesy call to us and made some donation. Ms. Senna, what was donated? Can you just quickly recap what they provided? Yes, trust fund. That was last year.
We had about 500 and something thousands of HIV diagnosed kids. We have some consumable hand glove and other things.
Okay. They provided that towards the tail of last year, right? Yes. And that was because our call and request was impromptu. But this year, I'm still following up with him because he said they will do more this year. So it's something we can also look at. We could portal IOM, do a joint visit to them to also expand on the framework we have established and see how we could contribute HIV data, SCI data to universal. Yes. So from what we got from HIV Trust Fund, we have used some of them. In Senna, we have used some of them for some of the testing. We initially on our own organized an outreach at the NACO wing of the international airport, and they turned out. We have the video. I can also share because for every outing we have a media component of it for OVI, observable verifiable indicators. So we have pictures, we have video from that. That was our first experience of reaching out freely to the community. And in fact, they are waiting for testing and counseling to clients that will service through the outreach. And then we also have some of these products which we have used in our first visit to IOM, and then we were able to screen some using those consumables and test kits we obtained from HIV Trust Fund. So I would like to give us the linkage now. I've explained the linkage to health insurance, looking at national and state specific, and then the linkage to primary health care through our outreach, and then the IOM approach. So these essentially on item 2 and 3, this is what I can see. For our migrants, again, when I came in, World Bank came to our rescue by recruiting about 180 personnel for 1 year for us, paying their full salaries. And Dr. Kafo has been the clinic manager attached to IOM from the beginning. I put him out and he has been sending in reports. He did a closeout report which is ready, which we can also share, and then from that report, from his experience, made some specific recommendations from the IOM experience. Now, one, he recommended that enhanced health screening should be instituted and strengthen health screening process to detect and address communicable diseases more effectively. That was not properly done until we brought in our lab services to strengthen the surveillance. Again, number 2, he recommended that data integration. Again, there's a flow from us as a point of service delivery, linking to Ikeja and the Solo, because we are at the borderline between Ikeja and the Solo local government. And our data got to these 2 local governments. And then how we also link our data to the state epidemiology, which is always in contact call with me. And then from the pool of what we have at the state, we send to NCDC, and then the Federal Ministry of Health, Department of Planning and Research and Statistics. So that is the pool. We have it on the diagram. We can also share that. So he emphasized very strongly on data and on the need to sensitize every stakeholder participating with us on this intervention among the migrants to know how the data flow is and have that information at hand. He also requested that this will support us in streamlining our tracking of migrants in terms of their demographic information and health status. Again, number 3, he recommended that resource allocation. Okay, allocate resources for personnel based on age, sex, and health status of arriving migrants. That is addressed to IOM to provide adequate support and care following up. And then number 4, he talks about interagency collaboration, foster closer collaboration between hotel services and IOM in a more efficient border management and health assessment. Again, this goes to all of the items you are outlined in the agenda. Then information sharing. So develop mechanisms to share relevant information with relevant authorities to ensure well-being of both the migrant and host community. And he made himself the last. He said to achieve a goal, he will recommend personnel handling the tax on ground to also be supported in terms of human resource. And so he mentioned himself, Dr. Ifeanyi Chukwu Okafor, Angela Boni, who is in the lab, and then Busayo Dokas, who is also a lab associate working with us. So these are his recommendations as the year 2023 was closing out. And again, the same issues as recommended is what has been captured in the agenda. So, since I've gone through item 2 of the agenda, item 2 also talk about IOM and mental health. So, we can tell us, okay, maybe I should come from my own position. Most of the work we have done handling migrants was just, yes, we are all over the country.
Coordination with us, supporting us to ensure that supporting that direction. This meeting that I come to, as you know, is the continuation with our health officer and solution sometimes. That was one led to this. So ensuring that this testing, counseling, testing, and linkages to the programs. There are established programs of HIV/AIDS in country. There are established programs ensuring that those people, because sometimes people
in terms of organization, you have IOM, you have other services. Harmful enough, I think IOM too, you have presence across the country.
Not necessarily everywhere, but we
Sorry?
have, not necessarily everywhere, but we have presence like in this southern part.
Even at zonal level, even if it's at zonal level.
At zonal level, I'd say in the south, we have
Yes.
and southwest, northeast, northwest, and then in Abuja. So it's not everywhere. But
Okay.
we do
That's
have
enough.
presence.
Yes, that's enough. I think I was in a program where the Ikeja also formed the Ikeja NGOs for malaria based on zonal level. And without working with the malaria sector, they are able to coordinate very, very effectively. So that is enough for us. For hotel services, I can see we're present everywhere in every state, but not in all the local governments. Again. Then for social workers, they're again everywhere. For health facilities, we also have a strength in the area of viral hepatitis. That's what we call the technical working group on hepatitis. They are spread across all the states. In fact, we wrote the HIV prevalence, global prevalence, with CDC, Center for Disease Control, which was published in Lancet. And you will see data from every part of Nigeria also represented in that writing. So we are everywhere. In terms of continuum of care, the gastroenterologists, which form part of the technical working group for viral hepatitis, know every location within their states, and so we could conveniently link up to them with them. And HIV services are the IOM, of course. With this triangular arrangement, we'll be able to handle very effectively and link properly for mental health and psychosocial support. For the infectious diseases, we don't have a problem. Like the text for viral hepatitis. In fact, I was the first national officer for viral hepatitis. So the policy and strategy was developed when I was on the desk. So, and that desk has been expanded. CDC even have zonal for about 18 states where they formed technical officers that are present. I know the technical officer for the Southwest. Okay, so we could link up with him to see the level of package in terms of treatment they have for viral hepatitis. HIV again, is the same, even more widespread. So linkages won't be a problem once we are able to come up with a roadmap of what we want, and then at what point it will be very clear. At the national level, the maternal and child health, they play a very, very critical role, because even the focus of the HIV Trust Fund is purely on mother to child transmission, and so they are heavily linked to maternal and child health care at the national level. And I can handle that. The mental health again at the national level, I also can handle that. But again, we will need not just IOM, but some of the other UN agencies that also work, even at staggered level, in those various states, to also join effort with us so that we can make progress. This year is most critical for this partnership, because whatever we are able to achieve, I can tell you, becomes a framework for the country. So we have to put all we can to make it successful. That is why, for example, even despite our meager resources, we are organizing 248 outreaches. We didn't care how the money was going to go. We just started anyhow. And now NEMA is willing to take 100% of the media components. I mean, getting media from outside and then to also provide some more content. So we have started, and I know making progress, we'll be able to have a very credible result in this 2020.
I have a question, please. For the social worker, what services that they do, or what kind of activity that is important?
Yeah, the social worker has come as a third sector. They are in between the private, the development partners, and then the public health, the public sector as a separate sector. And that's why we deal independently with a psychiatrist that has understanding of their framework and their services in peer support linkages to providers. I would have invited him here, but I think in our next meeting I'll invite him. We could talk very eloquently on how these social workers provide effective care in the area of mental health and social. Give me water.
Yes. I have a couple of questions.
Yes, please, sir.
Thank you, Dr. Mene, for the insights and sharing in terms of what the past and in terms of the blueprints that you're planning to work on. I think that the document, it's also to share with us. We also see across our programs what can actually fit into that. In terms of the linkages, that's the system period that we're looking at in terms of the referrals, access to primary health care, the people who are coming back. Some of them have not been vaccinated, even back to children not vaccinated. Some of them are coming back pregnant. Even though they are coming through Lagos, they might be going to other states. So how we work together to, in terms of partnerships with federal hospitals in various states and also state-based hospitals. Yaba is a very beautiful institution, but we had challenges in terms of having an
Yes, yes. That was why we had to get an independent because of their problem.
So I think this, having some kind of tripartite agreement where we could also get inroads to public health facilities that the migrants can be able to access at a much cheaper rate, and also get on the health insurance scheme. While we're not necessarily looking for a separate scheme, a separate scheme yes would be good in terms of its additional provisions or subsidies that can be made. But we're also looking at even them accessing as a Nigerian the services that are available and how we could make it easier for them when they come back to be able to plug into their health insurance scheme, so that they can access the services at a much cheaper rate. The support we can provide for them, and at least things up like the unit costs, which is 2,000. So the 15,000 naira, that's something we will provide. We may not be able to put it up for everything, but it needs to be robust.
Yeah, but once we start, we'll see more people coming in. Prospect to also support.
So we're happy to really take this discussion as far as look at these concrete partnerships that we established both in Lagos and also in other states where we may not even be familiar with the health facilities that are available. Somebody will come back in a way back in Kenya State, a way back in Katsina, and yet they need a continuous care. So how we could also have some modality, a roadmap, MOU or agreement that can really speak to how this support can be provided. And then just like what we mentioned in terms of those linkages that persons identified. As a mother who's come with a child, even if they may not have HIV, how do they plan into any kind of nutrition health program that exists within the states? They're coming back pregnant, how would they be able to benefit from the states that may have programs for women to be able to give birth at subsidized rates, and just for them to get that antenatal assistance as well.
Thank you so much. Yeah, we will do that. Yes, very clearly. And I think it's actionable. Whoever is in our report is an actionable point and to be followed. In addition to that, I will also suggest that our documentation as part of this agreement should also come out first as number 2 on the action plan, because we need full database of what facility offer what in terms of HIV. I don't know if you currently have that across the country. Because if you look at the distribution of this migrant, in fact, we did distribution last year. There is no part of Nigeria that don't go. You understand? And so we have to have knowledge of what database of facility exists, for example, HIV in Lagos State, and by implication in Southwest. Even if it's that one, we will get it, we will use that to make case for other states. And then we also need to know, to the best of my knowledge, neither Lagos or the National Health Insurance Authority has a specific package for migrants, but it's something they can consider available. It's something they can develop. And if that comes out clearly with this partnership, I think it's a great achievement for us. And so we will need to know the service coverage that exists for health insurance, not only at the level of Lagos, but also at the national.